Good afternoon. How are you today? So good to meet you. So you're here for your cranial nerve exam. Okay. I understand that you need some instruction on it and how it works. So, while I'm both going to observe you for this cranial nerve exam, I'm also going to go over it with my notes. Okay. Now, first things first. It is a neurological exam, and it's meant to identify problems with cranial nerves through a physical examination. Okay? And the first nerve we're going to observe is the olfactory. Now, smell is tasted in each nostril separately. Okay? So we have some smells here. And the smell stimuli should be non-irritating and identifiable. Okay? So I have these little cups. And what we want to do is, we want you to close off one side, your nostrils. I'm going to write notes as we're doing this. Okay. Now, close off your nose. What do you think? That's right, cinnamon. Okay. Now we're going to get the next one. Close over that nostril. Can you tell what this is? That's right, cloves. Okay. And now, the third one. Keep that covered. Okay. Toothpaste, yes. Okay. Now, I need you to take and cover up the other nostril. Okay, and we'll repeat it. Please close your eyes so you don't know which one I'm picking up this time. All right. What do you smell? That's right, cloves. Okay, here's the next one. What do you smell? Cinnamon. That's right. Okay, and for the third one, keep it covered and keep your eyes shut. What do you smell this time? That's right, cinnamon again, because you knew it was toothpaste. Very good. All right, that's done. So we'll check that off successfully. Now, as you do this, you can make a mental list of it and write your notes down as needed. This is usually skipped on a cranial nerve exam. Most conditions associated with it will be discovered in other ways. A lot of times it could be the result of a deviated septum, and at your age, I'm sure we would know that from your prior medical history. So, okay. Okay, now we're going to test your visual acuity, and it's tested with each eye separately. All right. I need you to read these notes that I'm going to hold up for you right here. Okay? And then read this line. Read this line. Read this line. Okay. Now, holding this up to you again, a different set of text, cover up the other eye. I need you to read this line this line, this line, and this line. Okay, very good. Okay, now I'm going to wiggle my fingers, cover one eye. We're going to test one eye at a time. And I'm going to wiggle my finger 4 quadrants. See that? Okay. Cover up the other eye. Okay. All right. Very good. Thank you. All right. Now, I want to check your light reflex in your pupils. So we're going to do that with this small light. Cover up this eye. Okay. Now cover up the other eye. There we go. Okay. Now, swinging the flashlight test involves moving light between the 2 pupils. Normally both direct and consensual responses are elicited when the light shines on the eye, with some dilation will occur during the first swing. Okay? Now I'm going to inspect for different things. Pupil size is measured, its shape, and any asymmetry is tested. Okay? So we're going to hold up this very small measuring device. And I need you to hold as still as possible. Okay. Here we go. All right. And let me come in the other way. I'm left-handed, so I gotta do it a certain way. All right. Very good. Okay, I need you to look into the distance and close one eye. Okay, are you looking at the spot back here? All right. And let me see something. All right. Very good. Very good. Okay. Excellent. All right. Let me get my glass. All right, with my little toy hammer here, I'm going to check some reflexive spots on your body. Okay, I need you to hold still. Let me check something. Did you feel that? Okay, thank you. Now I'm going to check some other reflexes on your body. Thank you. Now, do you feel that? Okay. Very good. Try to hold as still as possible. Okay. I'm going to test here. I'm going to push this way, push back. Push this way, push back. Okay. One more time. There you go. Okay. Now, with the other side, push this way and push the other way. Okay, very good. Okay. you have any pain here? Do you have any pain in your lower abdomen or in your legs? Okay, very good. I need you to hold still for just a minute. And the other side. All right, very good. Okay, and the other side. Okay, very good. That turned out better than I thought. Now I'd like to do a quick inspection of your facial muscles. So I'm going to ask you to do several different things. First of all, with my hands up, you clench your jaw. Very good. Okay. Feeling back in here. That's all right. Let me lower you down a little bit. We're on your chair. Now that we've inspected your lower body. A little more. There you go. Is that comfortable? All right. Very good. And can you push down? There you go. There. Push. All right. There. There. All right. Very good. Thank you. Let me check something I'm not quite comfortable with. All right. Mm-hmm. Okay. Hold still. This is an advanced. I need you to close both eyes. I just have to do a real quick scan. All right, got them closed? All right. Right in there. All right, here we go. Hold still. Scan will be done in just a second. All right. Are you having some pain in your jaw? Teeth? Can you do something for me? Can you raise both eyebrows? All right, just do the best you can on all these tests. That's the most important thing. Right here. Okay. Now, can you frown? All right. Smile. All right, hold still. You know what? Can I get a little stronger light here? Can I trouble you to open your mouth? Let me do a little quick. All right, let me see. Hold still. Okay. Push your tongue down. All right. Once again, if you could lean forward. There you go. Feeling around here. Yeah, right here. Yes, there is something. Right in there. Okay, can you puff out both cheeks? Yeah. All right. Now, I'm going to check something real quick while we're on the jaw. And we'll do a little more closer inspection. I'm going to have this flavor on the end of this clean stick. And I want you to taste it. Okay. Do you recognize it? That's right, cinnamon. Okay. Now let me get another one and a new stick. Okay. Let me try over here. Do you taste that? That's right, spearmint. Okay. One more just for me. Clean stick. is that. Okay, we're zoning in on it. Okay, do you have any numbness in there? Yeah, all right. Okay, let me, okay, can you open your mouth again? Just let me, okay, hold on. I need a little stronger light source. Okay, all right. Hold still. Does that hurt? Okay, that's good. Very good. Let me do a little checking here. Okay, we definitely have an issue there. Let me trouble you. If you mind opening your mouth, just take a real quick swab. There we go. Okay. And we'll do a quick test on that. Just writing some notes down. Okay, we definitely have it appears that we have a minor infection in your lower jaw. It has not penetrated deep into the tooth. It's more on the outside here. Okay, it's a swollen area. And what we're going to do is I'm going to use this topical pain reliever. I know you don't have any pain, but you might later, because I'm going to administer, well, that's the end of that sample. This is a sample pain reliever, and we're going to put that on this spot. Hold still. And you might feel some strange sensations. What we're going to do is I'm going to give you an advanced shot of medicine that will help remove that. All right. And if you'll hold very still, I will give you a shot inside your mouth. There we go. And hold still, hold still, hold still. There you go. It won't hurt. You don't feel it? Okay. All right. Now if you'll roll up your sleeve, the right one. Okay. I'm going to get a new needle, and we're going to give you some of this antibiotic for your whole body. You definitely did pick up an infection while you were being held. And we want to clear that up. So if you'll just let me get some antiseptic here. I have some cotton here. I'm just all over the place. I wasn't expecting to perform a minor procedure. Oop, here we go. Okay, let me wipe that down. Okay, just hold still. This won't hurt at all. And right there, I know it pricks a little bit. And okay. All right. No, I'm not a true medical doctor, but in this case, I do have the training to administer these shots because of the condition that you have. You definitely were affected by the creature at Coney Island. This is an infection in your body. It would have eventually pushed out. You would have had some lesions on your body. If you do notice any growth in this lesion inside your mouth, this infection, after tonight, you must return tomorrow right away, and I will perform further studies and I will do further procedures to mitigate it and remove the infection. I think we caught it in time. It wasn't that major. I think we're going to be just fine. I don't think you're going to suffer any future ramifications from this. In fact, if you'll open up your mouth, I'll just take a quick peek with my, oh yeah, it's better already. And you don't feel any pain, correct? Okay, very good. Okay, I don't think you have any damage from the creature's attack. I would like to have you just do a couple physical tests to make sure that when you did come in contact, you weren't hit or your spine was damaged. So basically what we want to do now is we want to test a couple little things. Open your mouth. And I know that was uncomfortable. I want to test your gag reflex. Let me just feel your neck. And I want to feel the back of your neck. And I want to run my hand down your spine. Okay. Spinal column feels good. Muscular feels good. Okay, can you shrug your shoulders? There you go. Turn your head side to side. Oh, you're very good. Stick your tongue out. Move it side to side. Okay. And with a clean stick. It's been long enough. Please open your mouth. Do you taste that? That's right, bubble gum. The sensation in that dead spot in your mouth and your tongue is already returning, or you wouldn't be able to taste that. It's a very strong flavor. It's making your mouth water. Good. That's a very good sign. I think we've gotten to it already. That infection looks like it's going down already. I'm pretty confident we're on the right side of this. Okay, I'm going to write you a prescription, and I'm not going to sign it because I'm not a medical doctor, but you're going to take this prescription out, and the doctor that is examining people out in the hallway, he will get you the medication you need. We have it right here. It won't cost you anything. This is free of charge from your government. We understand your inconvenience, and we want to make sure you're okay. Yes, that culture came back. And basically what I did was I took the culture that I took from your body and I put it inside this testing probe. And then I exposed it to a small dosage of the medicine that I put inside your body. And as you can see, it is gone. The culture that was in there is gone. That I took, the scrapings have basically devolved, evaporated, fell apart. So they no longer exist. They vaporized, if you want to put it in an easier way. And you should have a clean bill of health. All right. I think we've pretty much gone over everything. I'm glad we discovered that. Do you feel any other lesions or swelling on any other parts of your body? Okay, very good. Okay. I'm going to give you a small metal chip. This chip has a small locator in it. I'd like you to hold on to this chip for the next week or two. You're welcome to go to any post office in about 2 weeks' time and drop it into a mail slot, and the United States Postal Service will return it back to my office. All this does is, as long as it's in your pocket or you can put it inside your purse, but I'd rather it was on your body. As long as it's on you, we can find you if there's an emergency. So if any further medical issues pop up, lesions, discoloration of the skin, severe fever, loss of taste, blurred vision, or any skeletal issues, very sore joints. Now this wouldn't be like just a sore knee or elbow. This would be all your joints start to hurt, a very strong fever, your spinal column feels like it can't move. You immediately need to make contact with us, have somebody call, and wherever you are, we will know your location because you'll have this on you, okay? And it's set, it's like a tracking device, but it's set for your own protection, and after 2 weeks' time, which is how long the disease would be in your body without treatment. I'm just setting it right now, putting your name in it. You can just throw it in a mailbox slot. They'll mail it right back to us. So this is just for your own protection. We are not going to spy on you. It just basically puts a dot on a map. So if you're at the grocery store or church or in home and bed, we will know as long as you allow it. If you're not comfortable with this and you feel that the disease has not progressed and it's gone, you're more than welcome to send it back. Okay? We do understand your right to privacy and your civil rights in regard to not being tracked by the government. But in this case, we do need to do medical surveillance. In some cases, we're going to hold people for 2 weeks. I'm sending you home, but I'm sending you home with the ability to call me and my medical team in case there's an emergency. So is that acceptable to you? Okay. We don't want to hold anybody longer than they need to. The comforts of home will heal the body much faster than medical science ever can. The placebo effect does work. Okay, very good. So as long as you're happy, we will basically give you your papers. Just hold on. For your exam. Okay, now that I've shown you how to do it, I hope you can assist the team outside with examining other people. It's unfortunate you were infected at the hospital while you were trying to help others. And you can see how easy it is to spot. You're looking for lesions, discoloration of the skin, blurred vision. Cranial nerve exam will help you discover any kind of infection from the creature's blood-borne pathogen faster than just about any test out there. And we can get through a lot of people quicker. So as long as you're comfortable with it, I'll give you my notes and you can go out and join the rest of the team and help other people with their examinations. Okay? No problem. I'm glad I was able to help you. Please wear rubber gloves, but there's no chance of you infecting someone else. Yeah, it looks normal already. Very good. Okay. All right. Well, thank you very much. It was a pleasure to meet you, Doctor. And yes. As far as we know, it was a sound of a train lured the creature in. The lighthouse and foghorns of the tugboats in Lower Manhattan drew it up to shore, and when it heard a train whistle, it reminded it of a crying baby, much in the way a alligator child, baby alligator, cries for its mother, and the mother instinctively protects it. This creature thought it was looking for a offspring or a fellow creature, when what it was actually doing was trampling half the city. There were a lot of survivors. We've managed to rescue a lot of people. You being one of them. You don't want to see what happens if you don't get this taken care of. It's a very, very dangerous disease. Here's my notes. And I was very glad to meet you today. And I wish you the best of luck. Didn't I tell you my name? My name is Dr. Andrew Michaels. And I'm here to help you. Bye-bye.